Rocket Right Show. I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes, and our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center. And we're so glad today to have with us Johnnay Benjamin, who is the Director of Early Detection and Education.
Yes.
At Mary Bird Perkins, Our Lady of the Lake Cancer Center. So we're talking about this because February is National Cancer Prevention Month.
Exactly. A good month.
Yeah.
But you come and see us 3 times a year because this is really important.
It is.
And people tend to kind of put it off.
Yes,
Yeah.
and it's nice when we can kind of couple it with something else.
That's right.
So let's talk about some of the way that the Cancer Center helps the community with cancer prevention.
Well, one thing that we know is sometimes we hear the word cancer and we can be so afraid that we don't think about some of the things in our daily life that we can do to help us prevent cancer. And so instead of always kind of giving you the other side about treatment, we like to let people know there are things that you can do to improve your health or to be smart about the decisions that you're making and how that impacts your cancer risk.
Absolutely. I think you're so right on that. We don't spend enough time on prevention because there are so many daily things that you can do or avoid doing.
Yes.
That helps reduce your risk of a number of cancers in general. So
Exactly. We like to talk about how healthy eating or thinking about what you're eating and not necessarily dieting or yo-yo dieting or yo-yo eating, but just really thinking about what can I do over the long term that I can sustain, where I still have those things that I like, but I do it in moderation, where I'm conscious about the fruits and vegetables that I'm eating and having more of that on my plate. How do those little things play into my cancer risk and prevention?
Yeah, and they do so much. I always talk about people, lifestyle changes.
Exactly.
And you want to do the right thing about 90% of the time. But you're going to splurge and you're going to enjoy other times, but you're not having cake every night for dinner.
Exactly.
You know?
You're making those choices and thinking about it ahead of time. I know I want cake on Friday, so I'll try to do something else through the week.
Absolutely. And so also it's the education about reducing your risk for cancers, but then you go out into the community and do screenings.
Exactly. So we know that everybody can probably think of someone who they think did everything right. They didn't smoke or they ate well and they still ended up with cancer. And when you get into that situation, our best defense is early detection. And so we have mobile medical clinics. They are just like what you would see in a brick and mortar facility, but they're out where people live and work and play and worship and things like that, so that they're convenient and they're accessible. For a long time, we always thought the only barrier to care, or one of the biggest ones, was maybe health insurance. But now we find out there are so many people. We're busy. We lead busy lives. We have our families and our careers. And so sometimes that cancer screening doesn't quite get into the mix because you're thinking, I feel great. And, a cancer screening is something you do when nothing seems wrong.
Right.
You just, every year, I know I need to get this mammogram or I need to have my prostate examined or whatever it is. And so it's a way for us to bring that program to people. So they may not have to take time off from work or other things. They can see us in the evenings or on the weekends. So it's an opportunity for people who do or don't have health insurance. Whatever your barrier is, we think we're there to help with that.
Yeah, and I know during COVID, a lot of people were worried about going into the healthcare facilities. But let's talk about some of the things that are in place so that people can feel really comfortable that it's a safe environment to come, and you don't want to put that off.
Exactly. We spent a lot of time thinking about how can we do this safely. You just said how important it is. And so first, we're doing your paperwork before you get there. So it's over the phone. We're taking all of your information. So once you arrive, you call us from your car. You say that I'm here. We'll text you when we are ready for you. So you're the only person on the mobile unit. We've cleaned everything between you and the person that was before you and the person that will be after you. You come on board, you sign off on that one place, and then you're in with the clinician. And so we've taken a lot of time to think about how can we do that. We ask everyone to wear a mask. Our team has on a mask, and we're doing those cleaning and disinfecting practices that we've heard so much about very regularly to make sure that everyone is safe, our staff as well as our guests.
Absolutely.
I don't think Louisiana has ever been cleaner. We have never been so disinfected ever. We are all so well
Now,
disinfected.
the next problem, though, is going to be like with the environment. And what I've been seeing is picking up all those masks and gloves
Yes.
out of the streams and stuff.
Yeah.
How
Don't
are
throw
they
your
getting
stuff in
in,
the stream.
in there? I
So
mean, it's like,
we
you
do
know.
want people to be mindful and keep their mask with
Yes.
them, take it back into their car. But we do have those things in place, and I think you're right. We're washing our hands more. We're doing all of those things, and we see the benefit because we've had lots of people tell us how comfortable they feel coming onto our unit. They're not going into a large facility that they
Absolutely.
may not be comfortable with. It's more contained. They trust us to keep that small area clean, and so we've been happy to hear that.
And, you know, I think people are liking the fact that they drive up, they come in, they're seen, they leave.
Yes.
I think
Nobody wants to
they're
spend all
never
day doing
going
that.
to want to be in a waiting room waiting
No.
again.
And I'll tell you, my
know.
team likes it too.
Yeah.
Because we feel like we are being respectful of everyone's time, the way that we're pacing people. When you get there, we're just about ready for you. And
Well, you
so
know,
we know that's great too.
Everything probably runs smoother for the facility and the staff and the patient
Exactly.
this way. So,
it's
I think
a great
that's
time to come
great.
out and see us.
So which of the screenings are you doing? I'm curious about that when you do the mobile units.
So we ask people to give us a call because we try to switch it up so that people have the opportunity. Like this Saturday, we'll have a breast and skin here on Florida Boulevard in Baton Rouge. But there are other times where it may just be a breast. We always have colorectal kits available. We know that's something people put off sometimes. And so any screening that you get with us, we're going to go over your colorectal cancer risk and offer you a kit there as well. So we have some skin screenings, oral cancer screenings from time to time. Not as much right now, but those will be coming back. So it just kind of depends on the day.
And so folks might wonder, like if I go to one of the mobile screenings and something's found, what next?
We have a nurse navigator. That's such a great question because no one wants to hear something's wrong, go figure it out.
Right.
And so our nurse is on board at every screening. From the moment that you might find out that anything is wrong, she is there with you to help you make the follow-up appointment. Sometimes you just don't know who to call. And so to help you decide where you're going to get your follow-up, to call them, remind you to make sure that you went, what were those results? And sometimes you just have questions. That can be a very anxious feeling for somebody to say, oh, something is abnormal. And so to help you understand what that means, have that conversation with you is sometimes what people need from her. But she's really there to make sure that you get to resolution of that finding as fast as we can. We know that time is of the essence. We have great technology to treat cancer, but we can do more with it when we can identify a cancer early. And so she's there to either get you to that point or to where you find out everything is fine, or maybe come back in 6 months. So that's a great benefit of our program as well.
You know, one of the
Absolutely.
things we've talked about before is the what if, the fear of what if. And the navigators can help people just kind of do some emotional hand-holding.
Yes.
And say, no, it's not that, it's this, and then explain what their next step is and help get them in that appointment quickly.
Yes.
You know, and that's the biggest thing about cancer is the fear.
Yes.
The fear of the unknown.
It is unknown, and so you're right about that as well. Just to be able to say, this is what we know right now, and this is the next step that we need to take. And I do sometimes hear people say that they don't want to know, and I try to remind them, just because you don't know does not mean that it is not there.
Right.
And we have the technology and we invest in it, but let us use it. And we can use it when we can identify a cancer early, when you've done things to help prevent cancer in the beginning. Even if you were to be diagnosed, your body's able to fight a little bit differently when you've done those
Right.
things all along.
And
So-
a positive attitude by
Yeah.
being well informed is so
Absolutely.
important.
Well, let's talk a little bit about, as you said, people don't make time, but bring it into the workplace kind of helps with the
Yes.
time. Let's talk a little bit about how y'all do that.
So we were fortunate several years ago to get a gift from the Albemarle Foundation because they also recognize there are people who are working and have insurance and they're still not being screened. And so we are able to work with employers to design a plan that works for your employees, bring our mobile units to your place of your business, and see your employees right there. They make an appointment with us, they come out of their office, get their screening, and they're back in the office in 10 to 15 minutes. And so it lets them know that you care about them, you're
Right.
invested in their health, they can get this service on site, but then it also gives your employee peace of mind, or in some instances, we have diagnosed a cancer, but it's something they may not have found otherwise. And so
Right.
it's a great benefit to employees and employers.
Absolutely. They don't have to take off time. They take less time. And who wouldn't want their employees to be healthy? I
Exactly.
mean, it's awesome. So
And then the comfort of knowing nothing's wrong.
absolutely.
You know, after the screening, just like, "Whew, I'm okay." And then
Yeah.
they can support those who may be found positive for some sort of test, or perhaps positive.
Absolutely.
Not definitively.
So if someone's listening, they didn't know that you had this available to their workplace, or if they want to know more about your mobile screening, what's the best way to find out?
They can visit us online at marybirdlake.org/getscreened, or give us a call. We love to have conversations with people. So 225-215-1234. It's always been very easy.
That is so easy.
Just give us a call and let us talk through what's best. Where's the next screening? Which one should I go to? How do I get my employer involved? Those are all questions we'd be happy to answer.
And it's
Well-
important for employers. That's a great benefit to provide for your employees.
That's what we've heard. It adds value to everyone, and people are very excited about it.
Well, thank you so much. You're always such a pleasure to chat with. We've been talking with Johnnay Benjamin, who you can just reach out to over there at Mary Bird Perkins, Our Lady of the Lake
That's
Cancer Center, because you can see she is a wealth of knowledge.
She is.
And check out that website, which is marybirdlake.org/getscreened. We want you to do it all the time, but this is the month that we're thinking about it because it is National Cancer Screening
Yes.
Month. So, and up next, we're going to be seeing what the latest taco in town is all about. So stay put.